Hi, I'm Jack Cush. I'm executive editor of RheumNow.com, and this is the Week in Review as of Saturday, February 13th. Doing this a few days late, but got a little busy. Hope you enjoy this nonetheless. First, a quick rundown of some of the important tweets and tidbits of news that appeared on the Twitter feed. One is something you should know is that acute sacroiliitis can be diagnosed either by bone scan and CT, and most common diagnoses include pyogenic infection, brucellosis, something you may not have realized, crystal-induced arthritis, and or neoplasia. Another tidbit that came across, there was actually a few good tweets on great lectures that appeared, including one by John Varga on scleroderma. The FDA Advisory Committee will talk about in a second. The meta-analysis of 11 studies show that there is no association between chronic bisphosphonate use in oral esophageal or gastric cancer. That's a rumor or a bit of information that's been running around, has actually been shown in other studies to not be true. So it's good to know that a meta-analysis has shown basically the same. Psoriatic arthritis patients have a 60% higher risk of serious infectious events, meaning their odds ratio or hazard risk was 1.50, and that was significant. But that when you add a biologic on top of that, it only goes up to 1.56, so an additional 6% increase when you're taking a biologic and have psoriatic arthritis. A tweet from the from RWCS, a conference I'll discuss in a minute, where we covered a lot of data that basically shows that getting to RA faster, meaning the rate of change or the trajectory of change, may be as important as how deep you go as far as your disease activity scores when it comes to long-term remissions. But as you know, that there was a number of hot items last week. Actually, some of the features that we had were really quite amazing. It led off with the beginning of the week with a great blog by Dr. Joel Creme, the kingpin of methotrexate, wherein he talks about the history of methotrexate and where it all began, at least from his perspective. It has a 50-plus rich year history. In the 60s, methotrexate being used both in Seattle and in Cleveland. And then later on in 1982, Joel meeting up with Mike Weinblatt, and the rest is history. Methotrexate becomes solidified as a cornerstone in the treatment of rheumatoid arthritis. It's a great review for all rheumatologists who should be interested not only in methotrexate, but also the history of what it is that we do. The highlight of the week probably was the FDA hearing, which occurred on Tuesday, the 9th of February. It was a hearing wherein Celltrion, maker of the biosimilar version of Remicade, the product they have, their biosimilar is called CTP13, will be marketed as Inflectra, went in front of the Arthritis Advisory Committee and a total of 24 reviewers, which was a mix of rheumatologists, adult and pediatric, internists, pharmacists, statisticians, lay and pharma representatives, as well as protein chemists and others who are interested in the biosimilar field. A long day of presentation, fairly balanced presentations. The interesting thing about that hearing was the FDA came out ahead of time and said that this is a similar product. They touted that it seemed to that the application was meeting its benchmarks for biosimilarity. After a lot of discussion where there seemed to be questions about whether the panel and the doctors were going to accept the ideas of interchangeability, which actually was not part of the application, or extrapolation, which was part of the application, the vote was overwhelming, 21-3 in favor of getting the new biosimilar CTP13 approved. So we'll see what the FDA does going forward. Other highlights that appeared were the proceedings of what happened at the RWCS.com meeting. That's R-W-C-S.com. That's Artie Kavanaugh's meeting that occurs annually. It's a review meeting with a stellar faculty, of which I'm lucky to participate. And there were a number of great sessions at that meeting. Artie and I actually began it off with our version of sort of roundup, where we talked about things that were hot topics and things that happened in rheumatoid arthritis, a few of those being the surprise study out of Japan, where they showed that if you're failing methotrexate, and you need to now make another move. Do you add on with tocilizumab, or you just switch to tocilizumab? Adding on, or the combination, seems to be more effective than just the single drug tocilizumab alone in that Japanese population. The results look just like the Jesmer study, where the same thing happened when you added on Enbrel on top of methotrexate. And remember, in Japan, the doses of methotrexate are quite low, 6 to 7 milligrams per week. There were a number of studies actually that were reviewed last year that showed that in JIA, polyarticular JIA, who is in remission, and you're on a biologic and methotrexate, you can't go off therapy. That when you start to withdraw therapy, there are high rates of flares, especially if you try to withdraw the biologic. You may be able to get away with withdrawing or lessening the methotrexate use, but just like in adults, it seems that when you flare, when you withdraw therapy, there is a price to pay with regard to the future success and staying in remission. Results from the AVERT trial was interesting. The sub-analysis of the AVERT trial, which you may remember, is abatacept and methotrexate be given to patients with very early RA. They either received methotrexate alone or the combination, and then followed for a year. At the end of a year, everyone stopped their therapy. And not surprisingly, the combination worked better than single drug therapy. But the sub-analysis that we presented actually showed that if you had a very early disease and then started in the study, meaning less than 3 months disease duration, you were more likely to get a response early with the combination, but more importantly, when you stop the therapy, more likely to maintain remission or a low disease activity state. Almost threefold higher results if you looked at patients who had very early disease. Daphne Gladman was the kahuna for this meeting, meaning the grand teacher who was invited to give some perspective. She did a review of psoriatic arthritis and some of its history dating back to the work of Werner Wright in 1956, going all the way through until actually the Mole and Wright classification system. She shone some light on some interesting issues, including how frequent psoriatic arthritis occurs in psoriasis. As you know, the range there is often quoted as being very wide. Well, 3 recent studies say it looks like it's around 30% overall, and that the overall new case rate is 3.2 cases per 100 psoriasis patients seen in a year. And then there was a great debate by Alvin Wells, who was in favor, and Eric Ruderman, who was against the idea of medical marijuana. You've got to go to the website to see it to learn more. Lastly, at the end of the week, there was more being presented, both in multiple areas, including osteoarthritis by Oren Traum and Marty Bergman. Some highlights from their presentation was the FDA strengthening its warnings about the risk of myocardial infarction for patients who are taking chronic nonsteroidals. A very interesting study about intra-articular steroids, a 2-year randomized controlled trial where patients who received intra-articular triamcinolone every 12 weeks over 2 years. In the end, it wasn't shown to give any better results than placebo as far as WOMAC pain, walk time, and structural endpoints. A bit of a surprise. And following joint replacement, actually there's a study that shows there's an increased risk of MI up to 9-fold higher in the acute phase period following the joint replacement surgery. And the big news that they reviewed in their session was the release of a new drug for gout called lesinurad. This is a URAT1 inhibitor that will be marketed as Zurampic, and this drug is interesting in that it is very good at lowering serum urate levels, but has to be used in combination with another urate-lowering therapy such as allopurinol or febuxostat. Has moderate success in achieving the endpoint of a serum uric acid less than 5, but there is a risk, a black box warning for the risk of renal complications with that drug, so be sure to read about it before you use it. And lastly, there are a number of reports in gout talking about the co-associations and comorbidities associated with gout, including dementia, sleep apnea, septic arthritis, and even erectile dysfunction. So that's it. That's the Week in Review. Tune in next week. Follow us on RheumNow.com.